BUN is a value on the blood work that you'll hear about more often, whether it's an emergency situation like an acute illness or more of a chronic long-term condition as just your annual blood work every year. So BUN is often associated with kidney problems, okay? So why is that? BUN is a metabolic waste product. The kidney's job, one of their main jobs is to remove metabolic wastes. So metabolic wastes are just normal breakdown of foods and processes in the body, things get recycled. So BUN is a waste product in the blood that the kidneys remove. So basically, if the BUN is high, one of the main reasons is because the kidneys aren't removing it. So what is BUN? BUN means blood urea nitrogen. And what it is, it's a measure of the amount of nitrogen containing urea in the blood. So this is a metabolic waste. When it's high in the blood, it can cause a feeling of nausea. Now, nausea doesn't have to mean vomiting. Nausea can just mean that you feel queasy and don't feel like eating. And that's often what these dogs and cats and people with kidney problems, they just don't feel like eating because they feel a little bit nauseous. They're not always vomiting, okay? So where does this BUN come from? The nitrogen component is part of proteins, the proteins we eat and the proteins our body uses and makes and recycles for everything in our body. Enzymes are proteins or groups of proteins that do things and catalyze reactions in our bodies. And it's just everything is done with these proteins, okay? What makes a protein from a biochemistry point of view is like a hydrocarbon, carbon, oxygen, hydrogen chain, which everything's made of that basically. But when you put a nitrogen on the end of it, it makes it a protein. Well, once you finish using this protein in your body, it's been recycled and used several times, we have to get rid of the nitrogen, okay? That's the liver's job to take the nitrogen that's free in the blood after everything's been done. The nitrogen is floating around as ammonia, basically, which is really toxic. The liver will take up the nitrogen or the ammonia and it'll combine into two of those together into a urea. That's the urea and nitrogen of the blood urea nitrogen, the BUN. So the liver makes it into urea, which is not as toxic, but still it's a little bit of a waste product. And it's water soluble. Being water soluble, the kidneys can then put it into the urine and you pee it out or excrete it. And that's fine and dandy. That's the way it's supposed to work. So if the BUN is high, it's often an indicator that the kidneys aren't doing their job. They're not removing this from the bloodstream. The liver is taking the nitrogen and making it into BUN or urea, making it into urea, and the kidneys have to remove it. So it's high, the kidneys aren't removing it. The only other significant reason why sometimes it's high is raw fed dogs on a high protein diet. So a lot of the normal values, as I've said before, are set by mainstream dogs eating dry kibble, dogs, cats, people, whatever, eating a poor, crappy diet. The ones that are eating a lot of high protein raw food have more protein and therefore more nitrogen waste product. So their BUN can be a little bit higher than the normal range. When that's the case, it's usually 5 or 8 points or somewhere in that range. It's not significant. But there's 3 or 4 other things we measure on the routine blood work that also indicate kidney function. So if it's only the BUN and not the other ones that are high, then that's when you're accused that maybe that's not a true kidney problem. So what else does the BUN tell us? Usually, high BUN is a suggestion that the kidneys aren't working well, and that's very common. You're going to hear about that often. But if now that we know a little bit about where it comes from and what it does, we can use it for more things. For example, if the BUN is low, now that you know that the nitrogen that comes off of protein usage gets converted to urea or BUN in the liver, well, if the BUN is low, maybe that means the liver is not working right and it's not converting the ammonia to urea. So your little test question is, what else are you going to see on the blood work that's going to confirm that for you? Well, if the liver is not taking all the nitrogen or ammonia and converting it to urea, and therefore the BUN is low, then the nitrogen or ammonia is going to be high in the blood. Now, not all the common blood work checks ammonia. It's a special test. It has to be done differently. So it's not on the common blood work. But there's a special test for that that confirms liver problems. So low BUN can mean a liver problem, But the most important thing you need to know about BUN is when it's high, it's usually about the kidneys, as long as the other 3 or 4 things that we're going to talk about later that indicate kidney function, or as long as they're high also. If they're all high, it's a kidney problem. If only the BUN is high and your dog eats raw meat, that's just the diet. Okay.